So, Dr. Perlmutter, here's something I see not infrequently at our practice. As a matter of fact, I saw somebody today. She's had an open carpal tunnel, but it was in 2014. She's having recurrent symptoms that are similar to carpal tunnel. She still has a positive Tinel's, which is when we tap on the wrist and it causes a shock pulse sensation through the nerve that goes through the median nerve sensation strip on the hand. And she's wondering why she's having recurrent problems, and she's had a carpal tunnel surgery. Can you address that for me, please?
I sure can. Sometimes carpal tunnel releases that are done non-endoscopically through an open incision, which is a bigger incision here, may not actually have gone through the whole length of the carpal tunnel. Sometimes a very short incision is performed, not endoscopically, but open, because the ligament is thickest in the middle. And there are some surgeons that feel that if you just cut the central part of it, which is the thickest part, that they'll cure all their patients, when in reality it doesn't. Sometimes if you have this remaining part of the ligament that is undivided, if they do aggressive activities or if they swell years later in their life, they can get a repinching of that carpal tunnel because it was never fully completely released. The other major cause of it is some doctors and surgeons will put their patients in a splint after the carpal tunnel release and limit their wrist motion. And when scar tissue forms, it sticks to everything with the Latin name. It sticks to tendons, it sticks to nerves, it sticks to skin. And if they're not moving aggressively in the immediate postoperative period, those adhesions that stick everything together, including the nerve to the tendons, can cause a recurrence in their pain, even though they had a successful, well-done carpal tunnel release, but they were, in my opinion, inappropriately splinted afterwards.
Sure.
And perhaps not sent to therapy.
All right. So what that's saying is if you've had an open carpal tunnel done by somebody else, and you're having a recurrence of your symptoms, increased problems with your hands, you should be reevaluated, and we'd be glad to do so here at Carolina Regional Orthopedics.
We would.